death of an Olympic sprinter is bringing maternal mortality into the forefront.
Olympic champion Tori Bowie's medical examination after her death included a small note about her past health. This note mentioned that she had bipolar disorder, a condition that affects her mood. People who are familiar with track and field are feeling sad because Tori Bowie won't be participating in the World Championships that start in Hungary this Saturday. Her struggles with mental health were not something people thought much about. Her struggles were real and were known during her training over the years. They were also seen in her Florida neighborhood, where the police found her body a few days after she died at the age of 32. She was 8 months pregnant at that time, and the doctor said her death was connected to problems during childbirth. Her coach, Al Joyner, said that it wasn't that she was ignored. He thinks that people just didn't take her situation seriously enough. Bipolar disorder is a mental condition that causes big changes in how someone feels. It can be treated with medicine and talking to a therapist, but a lot of people who have it face serious problems, according to the National Institute of Mental Health. Even though Tori Bowie had access to help from the Olympic Committee and USA Track and Field, she didn't use those services before she died on April 23rd. Officials believe that her mental health played a part in how she dealt with her difficult pregnancy. She didn't get much help from friends, family, or doctors. These officials are talking about this secretly to protect private information. People from the Olympic and track and field organizations, who knew Tori Bowie as a sprinter, and after her retirement, talked to the media. They also looked at documents like her medical examination and police records. Someone even called the Olympic Committee to tell them about Tori Bowie's situation. Tori Bowie's neighbor talked to the Olympic Committee because they were worried about her. The committee told Track and Field, and they contacted her agent, Kimberly Holland. But Holland said that Tori Bowie didn't need help. Holland said this month that Tori had access to health care, and she didn't see any warning signs. She told a newspaper in June that Tori didn't want to have her baby in a hospital. The police went to Tori Bowie's house on May 2nd after getting calls, including one from a friend who was worried. This friend didn't feel safe going inside because of a bad smell. After looking at Tori Bowie's body, doctors didn't find any signs of foul play or drug use. Her bipolar disorder and her weight, 96 pounds, even though she was 8 months pregnant, weren't mentioned much. In her best times, she was strong and weighed 130 pounds. Doctors listed problems connected to giving birth, like eclampsia, as the cause of her death. Eclampsia can lead to seizures and coma. It happens because of high blood pressure during pregnancy. Black women are more likely to have serious problems during pregnancy than white women, according to the U.S. Centers for Disease Control. Tori Bowie was part of the 2016 U.S. Olympic gold medal relay team. She was one of 3 women who had problems giving birth. All 3 were black. But unlike the others, Tori Bowie didn't give birth in a hospital. People who know about track and field are really sad about Tori Bowie's death. Some feel that it could have been prevented. They also wish they could have told Tori how they felt. A retired athlete, Trey Hardy, said that he's sad about her death because he has struggled with his own mental health. When she was a baby, Tori Bowie was put into a home with other caregivers. Her grandmother raised her, and this shaped her life. Her coach, Al Joyner, said that it seemed like she always wanted to prove something. Even when she achieved things, she didn't think it was enough. Joyner said this way of thinking is risky. He believes that everyone is taught that if they work hard, things will be easy. But when things don't turn out that way, you stop believing in fairy tales. In many ways, Tori Bowie's career was like a fairy tale. She was very fast and good at jumping. She started with basketball in Mississippi, but when she tried track, everyone realized how talented she was.